So this is the male reproductive system, and it's actually showing you the bladder here so you can see the inside. So that's depicting the bladder. Everything superior to that is taken off, so you could see remnants of the external, internal iliac arteries. Well, this is at this point common iliac artery and vein. And then you come here, you can see the pubic symphysis, which is, don't forget bones and cartilage and anything else that you've learned in anatomy, because we're putting it all together now. And this right here is the urinary bladder. Posterior to the urinary bladder, we see part of the rectum. You see that? So now we're anterior and posterior. So this is still part of this. And now I'm going to do a sagittal cut, still the rectum, penis here, anterior, and now this is the urinary bladder that we could see the inside rugae on. And so if you follow the urinary bladder, we have one that goes all the way down to the exit, which is known as the urethra. That's a huge FMQ. So make sure you remember it's urethra, because we have two ureters from each kidney down to the bladder, and then our urethra from the bladder to the exit. So on the way down to the exit, we also have other organs and fluid that's going to take the same route. And directly inferior is your prostate gland. And we talked about this a little bit last class, because we said, well, when we see the urinary bladder and the prostate right down below, we could see how when this is enlarged, it would impinge or cut off urine from flowing through. So that's one of the big symptoms of an enlarged prostate or an inflamed prostate, is frequent urination or inability to urine. So it's like this, the starting and stopping kind of symptom. So you see that directly off of the prostate is another gland from the prostate itself called the prostatic urethra. So they both combine. There's another vesicle here depicted right there called the bulbourethral gland. We can't see it for some reason that clear on that one with an actual gland coming off of it, but this side does show it. And this one also connects with the urethra, and that becomes the ejaculatory duct. So the ejaculatory duct, they all going to combine in the same exit because there's only one, right? So when you see the actual cut of the whole male reproductive system, you could see that there's two areas on the penis itself kind of surrounding that urethra. This is the corpus cavernosum, and it fills with blood. It has a lot of sinuses that fill with nitrous oxide during an erection. So that's right there. And on either side of the urethra is your corpus spongiosum, corpus cavernosum. So that's that. On this view, this is still the rectum back here. And when you look at this view, you could still see remnants of the ureter coming down. Now this is the prostate here. So this is the urinary bladder. And then we have one called the ejaculatory duct going from this vesicle all the way down also. Well, when we come to this structure here, all of it is known as the scrotum, which is with the skin on. Then when we see on the inside, we see a vesicle here which encloses the testes, called the epididymis. And I've always thought of the epididymis as what's going on, you know, like the only gland there, and everything else to me looked like an egg, the white of an egg. And we see a spermatic cord going over here, and that is known as the vas or ductus deferens. So for a vasectomy, that's what gets cut. So are you completely functional otherwise? Yes. The only thing that's missing is whatever's being produced in here, which is what? Sperm does not combine with the ejaculatory duct. So all of these are not representing blood vessels, they're representing seminiferous tubules, which, because of testosterone, produce sperm. Sort of like an incubator. It really is. It's producing all this sperm, and there is a muscle here, and I don't think this model is even showing it, so I will have to find one that shows the muscle, called the dartos or the cremaster muscle, that causes the testicles to rise or lower depending on body temperature, because the testes have to be at a lower body temperature than the rest of the body, so because otherwise sperm die. And that's it for the males. So this now is showing the female reproductive system, and you can see still the area that we're looking at. Instead of having the urinary bladder show on the external surface, now this is the uterus that we're showing on the external. And this female model just happens to be pregnant. So we could see it being an enlarged uterus a little bit, so you can see what's going on. Now on either side of these, you could see the organ here in yellow. That's not adipose, but it's an ovary, and it's held together or by these projections, finger-like projections called fimbriae. And the fimbriae deposit the egg into the uterine tube or the fallopian tube right there. So you could see those on either side. We have a few ligaments up top. The broad ligament holds the entire uterus in place. So it's broad, everything that you can kind of see over here. This one here comes from the liver, and it's known as the round ligament. And that's really from your ligamentum teres that we learned from the liver, going all the way down through here.
Is that considered a pelvic floor?
Yes, this is the pelvic floor. Okay, so here's our baby. And if you follow the uterus, I'll tell you now, a lot of students get confused with a lot of the passages that are here. But what you're going to do as far as lab practical purposes go is just follow. How do I know that this is the uterus and not the urinary bladder? What is it missing? Rugae. Excellent. So these are my rugae. So this is my urinary bladder. If I follow the exit from the urinary bladder, what does that have to be? That has to be the urethra. And so prior to the urethra, you have this little piece of tissue here that's very similar to the male penis. And it has its erectile tissue called the clitoris. And right directly underneath is the skin folding. That's the labia minora. And over here is the labia majora. And now I'm going to go from the uterus all the way down. What does that have to be?
It has to be the vagina.
It has to be the vagina. So right there at the opening between the uterus and the vaginal canal is the cervix. These are tiny spots, so I will be using pictures blowing up what I'm looking at, because we all know how hard it is to pinpoint certain structures with a label on here. I have used pins before, so where the pin is what I will be asking. Then back here, this is the rectum, and then the anus down here. So we got 1, 2, 3 holes, right? So you follow those tracks to see where we are going with this. And this blue represents cartilage, because that's the pubic symphysis. Then it would look like this, where it would be the pubic symphysis, and you can clearly see that here.